Welcome back viewers. This is the third part of the 5-part video series of the human skeletal system. In the earlier 2 parts, we have talked about bones of the upper limb and thorax. In this part, you will see the bones of the lower limb that includes the phalanges, tarsals, tibia, fibula, patella and femur. So viewers, I will begin this video with the bones of foot. Let us start with the phalanges. You can see that the first to fifth distal phalanx are labeled here along with the first to fifth proximal phalanges. Now zooming into the phalangeal bones, you can see the middle phalangeal bone from second to fifth medial to laterally. Fractures of the phalangeal bones can be intra or extra articular. Crush injuries to the distal phalanx are also very common. This can be caused due to fall of heavy objects or twisting of toes. Great toe is injured most commonly. Now you can see here the proximal ends of the proximal phalanx articulating with the respective metatarsals. Moving proximally, you can see the first to fifth metatarsals radiating distally from the tarsals. Let me add up here some common fractures of metatarsal bones. Jones fracture is the fracture of the base of the fifth metatarsal caused by the pull exerted by the tendon of peroneus brevis muscle inserted into it. March fracture is a fatigue fracture of the third metatarsal resulting from long continued or repeated stress from prolonged walking or running. It is commonly seen in army recruits freshly committed to marching, hence the name is given. Next, I move on to the plantar surface of the foot. In this view, you can appreciate sesamoid bones. These are seed-like bones located in the tendon of peroneus longus. Sesamoid bones are connected to muscles and other bones by tendons that envelop these bones. Moving proximally from the metatarsal bone, you can see the tarsal bone. As you can see, the tarses are made up of 7 tarsal bones, which are arranged in 2 rows. In the distal row, from medial to lateral, the following 4 bones are visible. The 3 cuneiforms that are medial, intermediate, lateral, and lastly the cuboid bone. The medial cuneiform is largest and intermediate cuneiform is the smallest bone. Edge of the medial cuneiform forms the dorsal surface of the foot. Edge of the intermediate and lateral cuneiform bones forms the plantar surface of the foot. Isolated medial cuneiform fracture is the most common fracture of cuneiforms, which is caused by direct blow to the midfoot or rotational force applied to the midfoot. Next, you can see cuboid bone. Cuboid is the lateral bone of distal row of tarsus, situated in front of calcaneum and proximal to the 4th and 5th metatarsal bones. The proximal row of tarsal bones consists of 3 tarsal bones that are navicular, talus and calcaneum. They articulate with the 3 cuneiforms and cuboid bones distally. Now I will discuss in detail about the proximal 3 tarsal bones. First is the navicular, which is a boat-shaped bone situated on the medial side of the foot in front of the head of talus. Next, you can see the head and neck of the talus. Talus lies between the tibia above and calcaneum below. It consists of the following parts: the head, neck and body. You can see the articular surface of the talus, which is called the trochlea. Now coming to the plantar surface of the foot, you can appreciate the tuberosity of the navicular, which gives attachment to the tendon of the tibialis posterior muscle. You can also see sustentaculum tali, that is a part of calcaneum, which is a horizontal shelf that arises from the anteromedial portion of calcaneum. Fractures of the sustentaculum tali are rare injuries and are associated with high energy mechanisms. Moving towards calcaneum, you can see a groove for flexor hallucis longus tendon, which gives passage to tendon of flexor hallucis longus. Coming back to the cuboid bone, you can appreciate the tuberosity of the cuboid, which is on the plantar surface of the cuboid. The tendon of peroneus longus muscle passes through the cuboid to insert into the first metatarsal and medial cuneiform bones. Let's now move on to the heel of the foot. The heel of the foot is formed by medial process and lateral process of tuberosity of calcaneum. Calcaneum is the largest bone of all the tarsus and forms the prominence of heel. Normally, the angle between the superior articular surface and the upper surface of the tuberosity is 35 degrees. This angle is reduced in the fracture of calcaneum. Fracture of calcaneum is caused due to fall from height onto the heels. Thus, both heels will be injured at the same time. Calcaneum may also develop spur. A spur is an outgrowth on the heel bone caused by ill-fitting shoes, which can be painful. In this view, you can observe the body and fibular trochlea of calcaneum, which articulates with the fibula. Below the fibular trochlea, you can see the groove for peroneus longus tendon. As you may have observed, there is a similar groove for peroneus longus tendon in cuboid tuberosity. Peroneus longus is a lateral compartment muscle, commonly injured during sports injury. It can cause lateral instability of foot or avulsion. After calcaneum, let's talk about talus. As shown in the video, you can see the trochlea of talus, which articulates with the lateral malleolus of the fibula. Here you can see the posterior process of the talus, which comprises medial and lateral tubercle. In between these tubercles, you can see the groove for flexor hallucis longus tendon. Tendonitis of the flexor hallucis longus can occur due to friction of tendon or elongated muscle belly. Here I want to add something about the ankle joint. The ankle joint is formed by the distal articular surface of the tibia and fibula, the intervening tibiofibular ligament, and the articular surface of the malleoli. Together these constitute the ankle mortise. This is called the socket, and the socket articulates with the superior articular surface of the talus. Pott's fracture is the fracture of the ankle joint. The fracture of talus is caused by forced dorsiflexion of the ankle. This injury is called as aviator's foot, as it is sustained in an aircraft crash when the rudder bar is driven forcibly against the middle of the foot, which results in forced dorsiflexion of the ankle. The trochlea of talus, as you can see here, is divided into two parts, proximal and distal. The proximal trochlea articulates with the tibia and medial malleolus of the tibia. This marks the end of the discussion of the bones of the foot. Moving superiorly, you can see medial malleolus at the lower end of the tibia. You can visualize tibia and fibula in this view. Fibula is the lateral and slender bone of the leg, which is homologous to the ulna of the upper limb. Fibula also has a downward projection at the lower end called lateral malleolus. Moving superiorly, you can see the head, neck and apex of fibula. Common peroneal nerve can be rolled against the neck of the fibula. Injury to this nerve is common at this site, which can cause foot drop. As you can see here, after removal of the fibula, the lower end of the tibia has a notch for fibular articulation called fibular notch. On the medial side of the lower end of the tibia, you can see the medial malleolus, which gives a passing to the tendonus tibialis posterior. Going toward the upper end of tibia, in this view of the tibiofibular region, you can see medial condyle, tubal tuberosity and lateral condyle from medial to lateral. Ligamentum patella attaches to the upper smooth part of tibial tuberosity. In this posterior view, you can appreciate soleal line which gives origin to soleus muscle. Soleal line also gives attachment to the fossa of soleus, fossa covering the popliteus muscle and transverse fascial septum. Tibia is the major weight bearing bone of the body and it is attached to a less important bone, that is fibula. Just like bones of the upper limb, which I have discussed in the first part of this 5-part video series, the bones of the lower limbs fracture together. Fractures can be due to direct injury like road traffic accidents or can be due to indirect injury like torsion or bending of the bones. Now I will talk about the articulation surface of tibia. The tibia along with the femur forms the tibiofemoral joint, commonly called as knee joint. The articulation surface of tibia has medial intercondylar tubercle and lateral intercondylar tubercle, which gives attachment to anterior horn of medial and lateral meniscus of knee joint respectively. Knee joint is a very common site for injuries as it bears a lot of weight. Injuries can occur to ligaments due to indirect twisting or bending forces on the knee. Due to increased sports activity, meniscus injury is very common. Medial and lateral meniscus are usually injured as a result of sudden knee flexion with a component of knee internal or external rotation. Please note that the upper end of the tibia is the commonest site of acute osteomyelitis and inflammatory condition of the bone. Moving now on to the anterior aspect of the knee, you can see patella bone. The patella is the largest sesamoid bone in the body which develop in the tendon of quadriceps femoris. Patella has a natural tendency to dislocate outwards because of outward angulation between long axis of thigh and leg. A comminuted fracture of patella is called stellate fracture. This occurs due to direct blow injury to patella. Now I will move on to the last and the most proximal bone of the lower limb, the femur. This bone is also the longest bone of the body. You are able to see the medial epicondyle of the femur. In the posterior aspect of knee joint, you can see the medial and lateral condyle. They are separated by a deep gap called the intercondylar fossa. Medial condyle gives attachment to tibial collateral ligament of knee joint. The lateral condyles gives attachment to the fibular collateral ligament. In intercondylar fossa, there is attachment of anterior cruciate ligament, posterior cruciate ligament, oblique popliteal ligament and capsular ligament of knee joint. The condylar fractures of femur can be of different patterns. It can be supracondylar or intercondylar, that is either capital T or capital Y type, and unicondylar, that is involving only one condyle, either medial or lateral. Above the medial and lateral condyle, as seen here, are the medial and lateral supracondylar lines. Next, moving superiorly along the posterior aspect of the femur, you can see the linea aspera, which in turn diverges to form the lateral and medial condylar ridge, which I have explained earlier. Linea aspera gives attachment to vastus medialis, medial intermuscular septum, adductor longus, adductor brevis, adductor magnus, posterior intermuscular septum, short head of biceps femoris, lateral intermuscular septum, vastus lateralis, vastus intermedius from medial to lateral. The rectus femoris, vastus lateralis, vastus medialis and vastus intermedius are called the quadriceps femoris muscles. Please note that the shaft of the femur can fracture at three sides: upper, middle and lower thirds. In the posterior surface of the upper part of the femur, you can observe lesser trochanter, greater trochanter and intertrochanteric crest, along with quadrate tubercle. The greater trochanter gives attachment to piriform, gluteus minimus, gluteus medius and obturator internus, along with two gemelli. Vas major and iliacus are inserted on the lesser trochanter. Quadrate tubercle receives the insertion of quadratus femoris. Fracture involving either the greater trochanter or lesser trochanter or both are called as intertrochanteric fractures. Now in this anterior view, you can see the head and neck of the femur. Fracture of the neck of the femur is the most common fracture of femur. Fracture of neck of femur can be classified in various ways, according to the anatomical classification, Garden classification or the Powell classification. The head of the femur articulates with the acetabular cavity of the hip bone and forms the hip joint, which is a ball and socket joint. Now moving towards the hip, you can see that inferiorly the acetabulum has a notch called as acetabular notch, which gives attachment to the capsular ligament of the hip joint. Hip joint is also common to dislocations. Posterior dislocation of the hip joint is very common in car accidents. The injury is sustained by violence directed along the shaft of the femur with the hip flexed. This occurs when the knee strikes against the dashboard of the car, so it is called as dashboard injury. The anterior dislocation occurs when the hip joint is forcefully abducted and externally rotated. Central fracture dislocation occurs when the femoral head is driven through the medial wall of the acetabulum towards the pelvic cavity. Lastly, in this anterior view, you can appreciate all the bones with their parts that form the hip joint, that are femur and the pelvis, which is formed by ilium, ischium and pubis. With this, I have completed the anatomy of the hip joint along with anatomy of the lower limb. Thank you for watching this video. Continue to watch the third part of this 5-part video series about the human skeletal system, in which I will talk about pelvic girdle and vertebrae in detail. Please watch, like, share my videos and do subscribe to my channel for similar videos. Thanks for watching.